Okay, I will continue to talk about the polyethylene. Okay, today
Yes.
I will talk about the vitamin E polyethylene. This is a new topic of the polyethylene. Okay, please have a look. This is the diagram of the requirement for the next generation polyethylene. So currently, uh, cross-link polyethylene is the standard. But to improve the quality and longevity and strength of the polyethylene, we need to some improvement of the polyethylene. To the requirement should be the oxidative stability and the mechanical strength and wear resistance. We should fulfill this requirement in the same polyethylene. So one solution should be the vitamin E. Because uh, vitamin E is well known as the anti-aging agent. So as yesterday I talked about the free radical. This one, this is a structure of the polyethylene. This is a continuous shrink of the polyethylene. But after the irradiation, the free radical will be formed. So this is the free end of the polyethylene chain. Then after the radiation, to these two free radicals adjacent the fibers can be bond, so-called cross-link. But in the same time, we if we add the vitamin E in this situation, after the irradiation, the vitamin E can bond to the free radical. So in the some free radicals bond to the adjacent free radicals that can make the cross link, and some free radicals bond with the vitamin E. They can act as the antioxidant and anti-aging and improve the strength and the resistance for wear. So there are two types of manufacture the vitamin E polyethylene. One is vitamin E soaking polyethylene. Basically, this is a polyethylene. Then irradiation and heating can break the polyethylene bond. Then free radicals can be formed. In this situation, add the vitamin E. In other words, soaking. After the irradiation, making the free radical, then soak into the vitamin E blended liquid. Then vitamin E will bond and join uh, to the free radicals. Then a free radical can form the both vitamin E and cross-links. So this is the vitamin E soaking polyethylene. But using this manufacture method, so this blending of the polyethylene and the vitamin E is very weak. After the aging, for example, this in this study, after the 30 months, the 3 years later, the most of vitamin E is leaked out, gone from the polyethylene. Approximately 61% of vitamin E disappeared because in this method, so bonding is between the polyethylene is not perfect. It is only the temporary. And in addition, In this method, after the irradiation and making the free radical, the polyethylene is soaked, dipped into the vitamin E pool. So, ojomiso. So, this blending with the polyethylene and the vitamin is very, very superficial. So, there is only we can find the vitamin E, only the superficial upper surface and the lower surface of the polyethylene. But mid substance of the polyethylene, there is a less dense of the vitamin E. Only there is only the superficial in the superficial surface of the polyethylene, the most of vitamin E can be disappeared after the aging. So there is another way to manufacture the vitamin E polyethylene. This is the so-called vitamin E blended polyethylene. In the material of the vitamin, no, the polyethylene, in this situation, this is the ingredient of the polyethylene and add the vitamin E. Then the heating and irradiation can make the free radicals, but in the same time, in this situation, vitamin E is already exists adjacent to the free radicals. Then vitamin E is easy to bond to the free radicals, not only the surface but also the deeper area of the polyethylene. So bonding the polyethylene and the vitamin E is complete in the homogeneous, not only the superficial but deep layer of the polyethylene. Vitamin E can be added. Okay, this is a comparison between the conventional, that means very, very old polyethylene, no without a cross link. And the green one is the cross-link polyethylene. This is the second generation of polyethylene. This is the newest version of the polyethylene by the being blended polyethylene. This is the without the aging, but after the aging, the difference is antioxidant effect is evident in the vitamin E blended polyethylene. There is no antioxidant effect. It's over just no oxidation in the vitamin E blended polyethylene. And this is the mechanical strength. As you know, oxidation of the polyethylene can minimize the decrease the strength of the polyethylene. So they compared the conventional polyethylene and high cross-link polyethylene and the vitamin E. Interestingly, so the former, the conventional polyethylene is weakest. After the 4 weeks, the almost strength is disappeared. Next is the high cross polyethylene. The lifetime in the strength keeps a little bit longer compared to the conventional polyethylene, but if we blend the vitamin E into the polyethylene, so mechanical strength can be maintained too long compared to the conventional polyethylene. And similarly, the wear is low in the vitamin E blended by polyethylene. This is a conventional X3 And E1 means the conventional high cross-link polyethylene. Of course, high cross-link polyethylene improve the resistance for the wear significantly, but the equivalent vitamin E is the polyethylene, so it is more effective than the high crossing of polyethylene because of the effective of vitamin E. Oh, this is similar to the where reduction is around 70% is less than the conventional high cross polyethylene. And this is the strength. They compare the mechanical strength. So this is the post or the PS devices, and then compare the conventional polyethylene and vitamin E blended polyethylene. They compare the strength is significantly improved after vitamin E is blended into the polyethylene. They are the basic study. So how about the clinical study? One author reported the Red River study. So this is this is the excite removed polyethylene mainly due to the infection or other mechanical failure of the tibia tray. Then compared, this is the A, is antioxidant polyethylene. That means the vitamin E polyethylene. This is the normal high cross-link polyethylene. Then compared, this is the mean varnishing. This is the how can I say the polishing area. That means the good the articular surface. It is from the polished surface. So this is normal reaction of the polyethylene of to the contact surface between the polyethylene and the female component. This area, polishing area, is wider in the vitamin E polyethylene. This is a smaller the area of the polyethylene in the conventional polyethylene. That means other than this polishing area, varnishing area, some damage, for example, scratching, pitting, or abrasion can be found. So in the vitamin E polyethylene, there is a wider space of the varnishing area compared to the conventional polyethylene. This is the pitting. Pitting is uneven surface, some deep or small hole, the surface of the polyethylene. The number is greater in the conventional polyethylene. Similarly, the scratching area is more frequent in the conventional polyethylene compared to the vitamin E polyethylene. Abrasion area is a little bit higher in the vitamin E. There is no delamination and deformation. Delamination means some separation of the layer of the polyethylene. As I said yesterday, the polyethylene is made with the fiber. The vessel is that can make some layer of the fiber of the polyethylene. After the aging or mechanical breakage, they can separate the layer to the layer. We call it a delamination. Delamination is there no delamination, and this is a deformation. This means the torsion or change of the shape due to the mechanical uneven stress on the polyethylene. There is no difference. And totally, there is virtually no difference. It is a retrieval study and cross-link density and peak oxidation index. There is virtually no difference between the vitamin E and the conventional polyethylene. There is only the one difference is peak oxidation index of the unloaded surface is only there is a small difference. So in summary, in theory, there is many benefits in the vitamin E polyethylene, but in clinically, there is no difference between the conventional cross-linked polyethylene and the vitamin E blended polyethylene. But most of the study is very short term because vitamin E polyethylene can be available only 3 or 4 years. So most of study were very, very short term. So we need to check the long term clinical result in terms of this clinical benefit, or for example, less frequent to wear. The wear is the main cause of the revision surgery. So if we change to the vitamin E polyethylene, then revision rate for the polyethylene wear that can be proof of the benefit of the vitamin E polyethylene. But so far, there is virtually no difference. So both mechanically and clinically. This is the varnishing. Varnishing is very, very polished, very crystal clear, the surface. It is not, this is not bad things for the polyethylene, but this is a problem. This is a pitting. The smaller dip in the smaller hole on the surface of the polyethylene. In the same time, we can see some deformity of the polyethylene. We can see some deformity in uneven surface margin of the polyethylene. In the same time, we can see the pitting of on the surface of the polyethylene. This is a scratching. You can see the small line, the scratch line on the surface of the polyethylene. Also, it can formed by some hard body, for example, something like the fragment of the cement or bone can make this scratch. So we should take into account the other factor, but basically this mechanical property is improper. The scratch can be made easily, so it can be the show the mechanical weakness of the polyethylene. So this is a comparison of the oxidation of vitamin E and the high cross polyethylene. There is a very, very small difference of the two types of polyethylene. Varnishing, varnishing is less frequent in the vitamin E. This is some contradiction of previous study. And the scratching and pitting, the overall damage of the polyethylene is smaller in the vitamin E. And this is the area of the oxidation. Oh, this is the articular surface and the backside and anterior margin and the posterior margin and compared. And the articular surface and the backside surface of the polyethylene, some deoxidation is higher in the high cross polyethylene. But the difference is very minimum. Or maybe this study is maybe up to 2 or 3 years. So we need more time to prove the benefit of vitamin E polyethylene. So this is a correlation with time. There is virtually no difference between the vitamin E and high cross polyethylene. So in the near future, we can see if the vitamin E polyethylene is beneficial or not clinically. So this is a take home of this my talk. Vitamin E polyethylene has serologically and experimentally advantage over the high cross polyethylene, cross-link polyethylene. This Beaver study shows less damage and less oxidation in the vitamin E polyethylene than conventional high cross-link polyethylene. But there was no clinical advantage. That means the difference is minimal. And there is no clinical result, clinical outcome. For example, some clinical score on a pain score or reduction of the complication that require the revision. There is no difference. So longer follow-up is needed to prove the clinical benefit and advantage of vitamin E polyethylene. Maybe before 2 years ago, I started to use the vitamin E polyethylene, but I don't know if it is beneficial or not. And in addition, our average age of the patient is late 70s. Only the 10 years or the 15, up to 15 years is needed. Therefore, that patient, maybe this type of high quality polyethylene should be used for the younger patient. For example, 50s or 60s. But I don't know if it is beneficial or not for the 70s and 80s patient. But anyway, I continue to use the vitamin E polyethylene because it can be used for every patient in Japan. This is a Japanese special situation. So to using the vitamin E high quality polyethylene, the patient does not need to pay the external cost. The total cost is same. It is Japanese special situation. Okay, thank you. This is the end of my talk. Do you understand?
Yes. Yeah. Very interesting.
Yeah.
So you recommend